Alright, so the other hypnotics bind to your BDZ1, so they bind to one of the benzodiazepine receptors, but we don't see them doing any of the other pharmacological actions like decreasing anxiety. They are mainly just sedatives, hypnotics, things to get you to sleep. And we also see that they don't disrupt normal sleep stages like we see in your barbiturates, in your benzodiazepines, where they're shortening stage 3 and 4. There's low risk of tolerance in these, and dependency and withdrawal, so they end up being pretty good hypnotics, especially compared to your barbiturates and your benzos that have a lot of different side effects and can be easier to get addicted to. So these hypnotics are probably some you've heard of. Lunesta works really good for up to 6 months, but potential to have withdrawal effects with prolonged use. So if you stop abruptly with Lunesta, you can have some withdrawal, like insomnia. It can give you dizziness, dry mouth, and mild memory impairment. So you might not remember stuff on Lunesta. Sonata. This is really good for people who have a hard time falling asleep. Side aches are pretty similar with headaches, dizziness, some minor GI disturbances, and in the elderly can cause confusion. And then we have Ambien. This is like the most widely prescribed hypnotic on the market currently. It decreases the awakenings in the middle of sleep, and they increase your total sleep time, so you feel more rested within the same number of hours because it's increasing the sleep total time. Similar side effects, headaches, dizziness, sometimes mild memory impairment. Then we have Ramilton. This is a melatonin agonist, so it binds to the melatonin receptor, so it mimics melatonin. And what melatonin does is it promotes sleep. Ramilton, you'll see it's promoting sleep. Melatonin naturally gets produced when there is no lights on. So when your optic, so light comes in, your retina picks it up and sends a signal. It goes to the optic nerve, and you have this supraoptic nuclei that picks up on these signals and then sends a signal back to the pineal gland that there's no longer light hitting the retina, and the pineal gland starts making melatonin. It's like, all right, sun's down, time to sleep. And so if you're staring at screens late at night, light's still hitting that, and you're not getting the signal to go to sleep. And so if people have a hard time falling asleep, one of the first things that's said is make sure to turn off screens and lights before you go to bed, so you have time to build up that melatonin. A lot of people take melatonin as a supplement to go to sleep, or you can take Ramilton, which is a melatonin agonist, also helps promote the onset of sleep. Another sedative that is really commonly used is alcohol. It's the most widely self-prescribed, non-prescription hypnotic. Lots of people drink before bed. It helps them relax or whatever it is before they go to sleep. Problem with alcohol, or ethanol in general, is it's very lipophilic and it goes through your entire body. It doesn't just work on the central nervous system, which it does very well. It's dose-dependent depression, so the more you drink, the more depressed your central nervous system gets. There's also some slight analgesia and antipyresis, so also kills pain, also stops fevers. But of course, if you drink more, then you start getting ataxia, you start getting dizziness, you lose motor control, you may vomit, right? Vascularization, it has a vascular effect with vasodilation. Even in low to moderate amounts, you can get flushing of the skin where the blood vessels, especially in the cheeks, dilate, which, one, makes you feel warmer, but two, actually gives off more body heat. And so if you're drinking to stay warm, that's not the way to do it, because you're actually making yourself colder. GI effects is it increases your saliva production, increases your stomach acid and pepsin production, which stimulates your appetite. A common side effect of drinking is you get drunk munchies, right? Fourth meal or whatever Taco Bell calls it, where you want to go out and eat because it is stimulating these things that say, hey, you should eat. But if you drink too much, it irritates the gastric mucosa. It can cause ulcers, nausea, vomiting. With your blood vessels, with your kidneys, it blocks ADH, and so the posterior pituitary releases ADH, which is anti-diuretic hormone. It's what helps you produce more urine, it helps you retain urine, and so without it, you end up producing more urine, and you're also drinking liquids, which causes you to produce more urine. And so something you see with alcohol consumption is a lot of urination. Alcohol metabolism. You metabolize between 10 to 15 milliliters of alcohol an hour. This happens in the liver, and you go from alcohol to acetaldehyde. Acetaldehyde can then go on to make cholesterol and fatty acids. And your body's actually really good at using alcohol to make stuff out of. About 95% of the alcohol you drink gets used to make cholesterol and fatty acids. That's why drinking a lot of alcohol can cause you to build fats. Oddly enough, this rate of 10 to 15 milliliters an hour equals about 1 beer. And so if you have friends that drink a lot, they might hit a nice pacing where they're drinking 1 beer an hour, and they're staying at the nice whatever level of drunk they want to be at. Because that's how fast your liver metabolizes it. Side effects, again, acute intoxication with ataxia, impaired speech, blurred vision, loss of memory, blacking out. With severe depression, the body gets cold and clammy, your body temperature starts to drop, and then you can go into coma or death. Chronic consumption, so this is just like one night's worth, right? But over a lifetime, chronic consumption can lead to cirrhosis, Wernicke's encephalopathy, and Korsakoff's psychosis. People who want to stop drinking alcohol can take disulfiram or antabuse. What disulfiram does is it stops the acetaldehyde from being converted to acetyl coenzyme A, and so this builds up in the body, and that buildup makes you feel really gross, causes nausea, vomiting, headache. And people who are on disulfiram are told not to take any cold medicines that may have alcohol in them, because even that little bit can cause the nausea, vomiting, and headache. And so the goal is to associate drinking alcohol with feeling gross and wanting to vomit, instead of drinking alcohol, which causes a release of dopamine in the brain and rewards you for drinking alcohol. And so it's kind of this whole switcheroo. Alright, that is it for our sedatives and hypnotics. I'm going to go ahead and talk about antipsychotics in the next one.